Should we start? Well, welcome you all to this Jean Monnet Atlantic Network dialogue. It's my great pleasure. Welcome in particular to this panel 3 on security and inequality in the Atlantic societies. Let me first of all introduce myself. My name is Nuno Severiano Teixeira. I am a professor at the Nova University of Lisbon and director of the Português Institute of International Relations, and I will be the moderator of this session today. Allow me just a very, very brief comment before I give the floor to the speakers. We are talking about security and inequality. Speaking about security 20 years ago was speak about the state. Today, when we speak about security, we are not speaking about the state, or we are not speaking only about the state. We are speaking about people. 20 years ago, also, when we spoke about state, we spoke about the use of force. Use of force in internal security, police force, use of force in international relations by the armed forces. But today, when we speak about security, we are not speaking only about force. We are speaking about much more than the use of force. And often we are speaking about the use of knowledge, the use of science, use of knowledge, for instance, about water scarcity, about the knowledge about the global warming, the knowledge about virus, and of course, the knowledge about inequality. So this is the theoretical framework that I would like, in which I would like our discussion could take place today. So in this broad concept of security encompassing military, but in this case, non-military issues in different sectors, in different areas: economic security, societal security, environmental security, political security, biological security. And that's why we are today speaking about pandemics. And in particular, these multi-layered impacts of COVID-19. So this is our framework of debate. And to address this topic, we have today with us a fantastic panel, completely, I must say, gender balanced. We are only, I am the exception, and all the other are women. And this fantastic panel will address these questions. Let me just very, very briefly introduce the speakers. The first one will be Salma Daoudi. Salma Daoudi is Senior Researcher at the Policy Center for the New South in Rabat, and will speak about the pandemic of inequalities, and in particular, in the nationalism of vaccine. Second, Ana Santos Pinto. Ana is a professor at Nova University, a researcher at the Português Institute of International Relations. And Ana will speak about these multi-layered impacts, different impacts of COVID. Then we have Eva Garcia Schwecker. Eva is Senior Research Fellow at CIDOB in Barcelona, and will present a paper on the pandemic recovery and the urban inequalities. And Elena Sanchez Montijano, researcher and professor at the Center of Economic Research and Education in Mexico also. And finally, we will have as discussant of these 4 papers, Susana Peralta. Susana is associate professor at the Nova School of Business and Economics. And well, I would like to thank you all for having accepted our invitation for this panel and sharing with us your ideas, your views about this topic. And I will give immediately the floor to Salma. Salma, the floor is yours.
Many thanks, Professor Teixeira, for the introduction. I am very pleased and honored to be joining this panel today and to speak about the inequalities and insecurities that have sort of been exacerbated by the pandemic. So as we all know, the pandemic undoubtedly both uncovered and sort of precipitated the advent of a more individualistic world, one in which resurgent forms of nationalism, populism, and even isolationism so discord between states seeking to recover their health sovereignty in a frantic race against time, against nature, but also against each other. So this presentation will sort of seek to highlight how the COVID-19 pandemic both reflects, exacerbates, and perpetuates pre-existing inequalities and insecurities, and how vaccine nationalism can sustain the latter by politicizing and differentiating access to one of the best means of controlling the spread of the disease. So before further delving into the topic, it has to be noted that health inequality is not a tale that starts with the COVID-19 pandemic, and much less so one that ends with it. So health inequality has always shaped and reflected power imbalances and societal dynamics, both within and among states, which translates into differences in life expectancy, disease incidence and outcome, and healthcare access. So health inequalities are rooted in, shaped by, and perpetuated through other social, political, and economic inequalities, which are termed social determinants of health, including income levels, occupation and employment, education, socioeconomic status, ethnicity and race, gender, and so on and so forth. So these social determinants and inequalities are best studied through the human security lens, which is a human-centered reconceptualization of peace and security that goes beyond addressing the risk of disease to encompass instead the full spectrum of structural inequities that increase human vulnerability. So while there are 7 components to human security, and we all know them, so economic, food, political, environmental, personal, community, and health security, these cannot be fully dissociated from one another because their interrelation is key to understanding how human vulnerabilities are constructed. And to zoom in on health security, which is the main focus of this presentation today, we can see that health determinants are directly related to other facets of human security. So for instance, economic security is directly related to educational and employment opportunities, which have lifelong implications for health. Individuals with compromised health have greater difficulty attaining and maintaining employment, the loss of which can negatively impact physical and behavioral health. Food security relates to safe and adequate nutrition, which is necessary to avoid certain chronic diseases and develop higher level of immune resilience. Environmental security relates to clean water, clean air, sanitation, which are also necessary to avoid disease risk factors and vectors. Personal security is associated to the protection from physical and psychosocial threats, such as war, crime, violence, and various forms of abuse, which can leave both physical and psychological sequelae. Community security is associated with healthy lifestyles and strong support networks. And finally, political security ultimately rests on the protection of human rights. So the COVID-19 pandemic has laid bare sort of the violence of social inequality. As for most disadvantaged communities, COVID-19 is experienced as a syndemic, which means a co-occurring synergistic pandemic that reflects and exacerbates pre-existing inequalities and insecurities. So it truly has been an economic wrecking ball, eroding the social fabric of societies and carrying profound intergenerational consequences. It has exacerbated both individual and state level insecurities, deepening inequalities between and within countries. And the initial conditions and the varying responses of national and international institutions have truly played a detrimental role to the differentiated spread of the virus and its effects by geography, race, ethnicity, gender, and social class. So for instance, at the individual level, we're seeing a multiplier effect of burdens. The people who are most impacted by COVID-19 are also the people who are further marginalized by other factors, who health systems have historically failed to adequately care for, who suffer from poor living conditions, including poverty, insanitation, insalubrity, and overcrowding, and who have limited access to health services and insurance. These groups are more likely to be more exposed to the virus, given higher risk for job exposure. So for instance, people working most essential jobs, which are often low income jobs, are more exposed to the virus. They have more constraints when it comes to social distancing. And at the same time, they also have higher rates of communicable and non-communicable diseases, which leave them more vulnerable to COVID-19. And so in addition to this exacerbated vulnerability and exposure to the disease itself, what we notice is that those groups are also more vulnerable to its other social, economic, and political ramifications. So on the socioeconomic level, we can talk about income loss, job loss, educational disparities that are widening by the day, food insecurity, domestic abuse. And we can see this perhaps affecting even more countries in the South Atlantic, where the job market features an important informal sector, whose majority of workers lack social protection and access to quality healthcare. So according to the ILO, informal employment accounts for about 85% of all employment in Africa, with a contribution of between 30 and 60% of GDP. And so given the low and unreliable incomes of most informal sector workers, the COVID-19 shock is truly generating severe livelihood losses and pushing more people into extreme poverty. At the political level, we notice further marginalization and exclusion, especially for minorities, and mounting state and police violence in certain countries. So as we can see on an individual level, the pandemic is truly reversing decades of progress in poverty reduction, in the promotion of education, in health improvements. At least an additional 100 million people have been pushed into extreme poverty in 2020, while acute hunger doubled to 260 million people. And so we can even say that a lot more people might suffer from the consequences of poverty-related ramifications than from the direct health impacts of COVID-19. On the state level, we notice that these individual insecurities fuel national insecurities. So health is a key driver of economic productivity and social well-being, the absence of which can be detrimental to a state's functional cohesion, basically. So health insecurity can have substantial knock-on effects on everything from rising crime to reactionary nationalism, thus threatening the very stability of political systems. And we notice that the load on health systems at the peak of pandemic waves is significantly obstructing access of non-COVID-19 patients to healthcare and compounding health insecurities. In countries where there have been pre-existing underlying tensions, the pandemic's impact on insecurity has intensified and increased risks of instability by exacerbating corruption, increasing extreme poverty levels, breeding misinformation, stigmatization, and hate speech, reviving social grievances, and creating new flashpoints for attention. So given constrained financial capacities, most states in the Southern Atlantic have had to divert financial resources from other key sectors, which is likely to undermine years of progress and to divert these countries from their development trajectories. And such radicalizations of grievances and tensions can also ignite social unrest. At first, such unrest is not necessarily easily discernible, as lockdowns and social distancing measures can hamper the communication, transportation, and mobilization needed to organize protests. However, over time, these grievances significantly increase the risk of riots and anti-government demonstrations, usually over issues that have been exacerbated by the pandemic, as we have seen in Lebanon, but also in the United States to an extent, whereby the pandemic highlighted and exacerbated pre-existing racial disparities and tensions. And in regions where conflict already unfold, the pandemic is severely hindering diplomatic action and complicating peacemaking efforts, while oftentimes providing further opportunities for armed groups, especially in the Sahel, for instance, to further their agenda, perpetuate terrorist attacks at higher rates, and even attempt to instrumentalize government's failure to provide adequate healthcare to fulfill such state responsibilities to sort of try to replace the state and mobilize popular support. So in that sense, we can say that the radicalization of conflict drivers due to heightening human insecurity increases opportunities for conflict flare-ups, all while diverting key political and financial attention from pressing security and governance challenges. So the question really is, how can vaccine nationalism perpetuate these inequalities and insecurities? As the pandemic's impact grows, so too will the risk of tensions and instability, magnified by inequalities in the global recovery. As richer countries get vaccinated, most countries in the global south, the South Atlantic, including countries already trapped in conflict and instability, risk being left behind, causing a severe blow to peace and security. So there are many challenges to the equitable distribution of vaccines. First of all, we have the supply-demand gap. Production capacity is arguably perhaps the key bottleneck at this time, paralyzing and stalling vaccination campaigns across the Atlantic, so both in the North and South Atlantic. But this is felt more strongly in the South. Not enough doses can be produced to cater to global demand due to inexorable material and logistical constraints. The other issue is affordable pricing. So prices might constitute an unaffordable expense to many governments. The WHO has initiated the COVAX facility to try and promote global access to COVID-19 vaccines, but this initiative still lacks the political and financial support needed to effectively achieve its aim. Another challenge is that of distribution. So while most rich countries have robust digital systems and delivery infrastructure, this is logistically and organizationally complex in resource-constrained settings, especially for vaccines that require deep freezing change. A final challenge is vaccine hesitancy. So various misinformation campaigns are proliferating both online and offline and fueling anti-vax feelings, which calls into question the extent to which the uptake will be high enough to even control the spread of the virus. And so vaccine nationalism acts as an intensifying challenge. It exacerbates and forms an integral part of these challenges to global vaccine access. States' aspiration to assume the responsibility of protecting their population is legitimate in itself, but when faced with the logistical and material constraints mentioned above, this limits global production capacities. It unfolds as a merciless vaccine race at the expense of countries without access to comparable resources. So vaccine nationalism, meaning this race for priority rights to monopolize limited production doses, is sort of threatening to politicize access to vaccines. High-income countries, which represent about 60% of the global population, have reserved more than 90% of the global vaccine supply that is available in 2021 for themselves. So as such, each individual state's prioritization of its own population's immunization, which is an indicator of popularity and a prerequisite for regaining a semblance of normalcy, results in access inequality. So far, over 90% of the doses that have been administered have been so in high and upper middle income countries, despite only accounting for 53% of the global population. So these delays undermine the life-saving potential of the vaccine, as border closures are only transient and easily permeable. And the WHO estimates, for instance, that around 70% of the global population need to be vaccinated in order to attain herd immunity. But today's two-tier system is likely to jeopardize this objective and concurrently exacerbate the global divides and inequalities mentioned previously. So the need to bring COVID-19 vaccines to the world equitably is pressing, especially as we see more infectious strains of the virus emerge in multiple countries and spread rapidly across the Atlantic. From a public health perspective, nobody will be immune to the emergence of new vaccine-resistant aggressive strains mutating and spreading freely among non-vaccinated populations. So even those already vaccinated could be infected by these new strains. And these may force countries to close their borders for longer, further damaging their own economies. So countries with limited vaccine access will be excluded from economic recovery, potentially costing the global economy as much as $9.2 billion, over half of which could be costs borne by advanced economies. And so both developing and developed countries will suffer from the economic costs of the pandemic, even those which effectively vaccinate their populations and contain the pandemic, given interdependent trade linkages. So such unequal recovery will end up exposing more people to unemployment and precariousness, while at the same time widening educational disparities that hinder social mobility and could undermine decades of progress. And as we've noticed earlier, the radicalization of those grievances, of socioeconomic tensions and conflict drivers arising from the multifaceted impact of the pandemic may lead to chronic humanitarian crisis, the spillover effects of which will transcend both geographical, political, and social boundaries. So this will be sort of my concluding thought. I think that this really does bring to the forefront a very recurring issue in the international public debate, and that has been spoken about and debated for quite a long time, but which has not yet been solved, which is with regards to the status of health and by extension vaccines as a global public good. So now is truly the time to reflect on the status of health as a real global public good and try to implement solutions that further promote equitable access to health services and vaccines. Thank you very much.
Thank you. Thank you, Salma, for your interesting ideas about this top question, which is the nationalism of vaccine. I'm sure it will raise some questions in the debate. And thank you all also for respecting the time. Well, before I give the floor to Ana Pinto, I have to say something that I forgot in my first intervention, which is all statements expressed by Fundação Getulio Vargas, employees and guests in our online events and broadcasts exclusively represent their opinions and not necessarily the FGV's institutional position. We also reiterate that everyone present here agreed to participate in this event in their own free will, and they consented to be recorded in this broadcast, which will be posted later on FGV's official channels. So now I give the floor immediately to Ana Santos Pinto. Ana, the floor is yours.
Thank you very much, Professor Ana Sofia Teixeira. I would like to start by thanking the organizers of this conference for the invitation and the opportunity to share with you some thoughts on COVID-19 pandemics and its impacts on society at different levels. And I will going to try to touch in 4 layers of analysis: societal, political, socioeconomic, and the security layer on a more broad approach to this impact. Looking to the literature that has been produced regarding the consequences of the pandemic, it is more or less consensual, the assumption that this global pandemic is an accelerator of already existing trends. And I think this assumption can be applied to all the several layers that I identify, and I will start by the societal layer. And on the societal layer, and picking on the Professor Sofia Teixeira introduction regarding security and traditional security and the state, I think this pandemic put again in the debate the evolution of citizens' perception regarding security. And with this, I mean the sense of feeling secure is very different of being secure. And we're going from the traditional security concept, more focused, as professors say, on state, on war, on conflicts between states and inside states, to a more broad societal concept of security that is now centered on social economic risks and threats, as well as promoted by the current pandemic environment on health security. And when we go to citizens in the current context, they are less afraid of war and physical attacks than the consequences of social economic crisis or being affected by the pandemic and need medical treatment and be contaminated by the virus. So this could lead that the states need to adapt to these new demands from citizens, adapting its institutions and adapting its public policies that could correspond to this new perception of security. And is also, and I'm going to talk about this regarding the European defense, this could lead also to a reorientation of investments in what we feel like security investments. My second layer of analysis is the political one. And here I would like to distinguish 2 dimensions. The first is the international community response to pandemics. And the second is the tension between democracies and authoritarian regimes that Salma already talked a little bit on the question of the vaccines, because it's different on the responses to the pandemics and to the citizen needs and demands regarding the state. What I think that we can look to the international community response is a failed of multilateral institutions, fragilizing the Health World Organization, and the nationalization, as Salma argued, about how to respond to this and the impact that this have on the legitimacy of international institutions, the efficiency of international institutions. On democracies, we are talking about national governments that need to respond to these constituents and winning elections. On authoritarian regimes, and here the most debated countries in the literature is China and Russia, it's completely different, because authoritarian regimes do not need the same type of accountability to public opinion, so they can use this context to their own, with their own vaccination and the vaccines they produce to reinforce their areas of influence. And this is a kind of diplomacy of health that is being made not only with developing countries, but also with other countries with different access to vaccines, and also in the case of the current debate in the European Union regarding the Russia vaccine approval. But it's also representing, in my view, some challenges, important challenges to democratic societies. The first one is disinformation. If we look to a speech that was made by the High Representative for Foreign Policy and Security, Joseph Borrell, on June 2020 on this topic, it says that disinformation really look like a fuel to the crisis that he entitles like having biblical consequences, because disinformation is used by populist nationalist movements that go against science data, that go against the empirical validation that institutions, international institutions try to do, and that are accepted by citizens because they easily accede to the speech, to the narrative, and to the information basically by social media. And these national and populist movements have alternative proposals to allegedly respond very simple to complex problems, but which part of the political community is considered to be viable and support these solutions. So here democracies are having very difficult moment, and it's not easy to answer, and I think it's a debate inside democracies to sustain and to consolidate a narrative on their values and principles, and to communicate with citizens on this topic. Of course, that in the response to the pandemics and inside democracies, we should also look to data treatment and privacy guarantees. And I'm talking, for example, on the apps for mobility control, contact tracking, and epidemic transmission chains that put some very interesting debates on biopolitics and on the way that these new technologies can have a good use or a very pernicious use to freedom and citizens' rights and guarantees. And from here, I go to my third layer, that is the social economic one. It's transversal to this seminar, and regarding this panel also, the increasing of inequalities, and as Salma already pointed out, the reversing of the progresses that were achieved in last decades. And we are talking about very different inequalities. Inequalities between countries, between economies, between social groups. Some of these topics are already talked here, but I would like to highlight the inequalities, for example, regarding the access to education in child and youth. Because, for example, the closure of schools can lead that many children do not return to the educational system for economic reasons, increasing child labor and promoting less capacity to the youth in the future to adapt to the labor market. So we are talking about 2 or 3 generations that for very different reasons are going to be affected by this pandemic, and the ambitions and the quality of life, the expectations that they have for the future. Also, very important inequalities in the access to health services, not only to vaccination. We are talking about primary health services, to medicines, to medical treatment, to prevention, and different areas of health. For example, already talked, but I think it's important that the gender inequality in the impact of this pandemic, it's very, very deep. And for example, in the cases of girls that have problems in access to sexual health support, to basic health support, and of course with a very different impact in the underdeveloped countries and less developed economies. And with this inequality point, I will going to look to my last layer, that is the security one. I think that all this context in the last year and looking to what we perceived as a very, very important economic and financial crisis that is going to be in the very short and medium term, that can generate a series of social upheavals that will not be restricted to developed economies, but to all societies. And in my view, in particular to low-income societies. So we are talking about internal convulsions for political structures, and that means that we can expect an increasing of an increasing of international conflicts. So who works on conflict resolution and prevention, stabilization of conflicts? Well, the international institutions, but here, if you allow me, I think that the European Union has a very particular role. And that is why I would like to talk and end my presentation with the question of the EU security and defense policy. Of course, that this pandemic revealed the vulnerabilities of EU member states' infrastructures and supply chains, and the limited competences of the EU in supporting its member states in the management of public health emergencies. But that is an internal question that needs to be dealt inside member states and inside the EU political system. We also internally need to look with growing attention to the IT security and the cyber capabilities, the interconnection between conventional and unconventional security risks. And here the disinformation is a very important role. But I think that the EU should look to the lessons that it can learn in order to better manage and prepare for a future crisis. And this is one of the questions that were raised to the panel. The COVID-19 pandemic has turned very clear and even accentuated the already recognized capacity shortfalls of common security and defense policy. For example, in strategic lift, in secure communications, and in command and control with direct impact on the missions in the field, the several missions in the field. So the EU should look now to how CSDP missions can become more resilient, is used concept in the European Union lexicon, become more resilient in public health emergencies, and which capability shortfalls need to be addressed the most. And this is a political decision, but also a strategic decision. We should also look in this framework on how defense spending can be made more efficient and better targeted. Because it's my opinion that the defense spending through EU instruments, as the EU Defense Fund, but also at the national level, will become under really pressure regarding the new social and economic challenges and needs. So we can look to the last years of progresses of EU defense policy, and probably will not have the same path of evolution in the next years. But we also need to consider how the EU can help to better coordinate military and civilian support authorities, invest in health intelligence, and better managing the biosecurity risks that arise from growing access, for example, to dual-use technologies. So directly and indirectly, EU security and defense policy is affected by this COVID pandemic, and for the future, the EU should forge a preventive approach to this future pandemic and its associated risks that we see that are very broad, and embrace this comprehensive approach, a concept that is so used in the EU policies, but also use this comprehensive approach to security and defense resilience. Thank you very much.
Thank you, Anna. Thank you. Thank you for your challenging thoughts in these different layers and in the long-term impact of COVID-19. Now I'll give the floor immediately to Eva Garcia Chueca. Eva, the floor is yours.
Thank you very much, Professor Teixeira. I will share a PowerPoint presentation with you. Let's hope it works.
You can share your...
Yes, I will share my screen. Okay, can you see it?
Yes.
Okay. Now, well, first of all, thank you very much for the invitation and for the opportunity to participate in this panel. I will present a work in progress on post-pandemic recovery and urban equalities from the perspective of cities, which will be the basis of an academic paper that I will develop in the framework of this network. And the paper will basically assess the main challenges posed by COVID-19 in cities of the Atlantic region from the perspective, as I said, of urban inequalities, with the objective of reflecting on possible recovery paths. However, in today's presentation, I will only refer to the challenges and not to recovery strategies, because time is scarce, and in particular, I will reflect on the impact of the pandemic in urban settings by paying a specific attention to the following dimensions: territorial, socio-economic, race, age, and gender inequalities. So, the assessment and the main challenges identified so far. A first idea that I would like to share with you is that COVID-19 is fundamentally an urban pandemic. According to the United Nations, around 95% of cases of COVID-19 have been reported in cities, and this means that the virus has affected nearly 1,500 cities all over the world. And this explains why the data gathered during the pandemic by a huge number of online trackers and monitors importantly refer to city and even sub-city level emergency responses. As you can see in the graphic showed in this slide, 43% of government responses tracked during the crisis were taken at city level or below. At city level, a total of 29%, and below city level, a total of 14% of government responses. And this trend is also visible in the World Bank predictions. According to this organization, in 2021, a rise of a wave of COVID-19 driven new poor will emerge. And it is estimated that 8 out of 10 new poor will be found in middle income countries, originating predominantly in cities and urban areas. So because of the prominent urban nature of the crisis, a number of systemic urban vulnerabilities has been exposed, in particular regarding to healthcare systems, precarious housing opportunities, unplanned urbanization, lack of adequate housing and sanitation facilities, or access to livelihood, to give some examples. And in some countries of the Atlantic region, the privatization of basic services, health, water, the privatization also of urban transportation, or even the financialization of housing are highly related to these urban vulnerabilities, which are they are at the root of these vulnerabilities. And these problems have gained special relevance in the midst of a global health pandemic because they have seriously compromised the right to health. And why? Because quarantine is very difficult in overcrowded homes, for instance, if not impossible, and it spreads the disease. Because washing hands if piped water is not available means traveling to a shared tap, and this makes very difficult to self-isolate, or because informal and low-income workers have been compelled to continue working during lockdowns for fear of losing income, jobs, and the capacity to feed their families. These realities show to what extent having access to decent housing, to basic services, or to livelihoods is so much linked with the right to health. If these rights are not ensured, the right to health is seriously jeopardized. So I argue that the urban socioeconomic vulnerabilities underpinning COVID-19 in the Atlantic region urge us to tackle the pandemic through an urban lens, because there is a clear link between today's extended urbanization and global health. And this is why attending to urban equality seems to be a must for pandemic responses to engender healthier and more sustainable societies. If we look closer to these urban vulnerabilities, we will discover certain territories and bodies. And now I will try to zoom in some of the main urban inequalities aggravated by the pandemic. And I will refer specifically, as I said before, to territorial, socio-economic, race, age, and gender, the gender impact of COVID-19 crisis. But first, a preliminary reflection. COVID-19 does not land in a tabula rasa. It rather sits on existing problems that both shape the pandemic and are impacted by it. To be more specific, the last economic crisis from the late 2000s is not overcome in many countries yet, and the fragility derived from years of austerity, precarious labor opportunities, or weak access to livelihoods interweaves with the new economic shock caused by COVID-19. And this overlap of crises is exacerbating several urban inequalities that existed prior to the pandemic, and it also adds, in some countries of the Atlantic region, to other ongoing crises, such as structural poverty or severe hunger, urban conflict and violence, natural disasters, be it hurricanes, floods, earthquakes, or long-term health problems like epidemics. And how does this translate in cities? Well, in urban settings, we observe that the impact of COVID-19 has aggravated pre-existing spatial disparities manifested by residential segregation, poor access to services, and homelessness, to give some examples. And that means that deprived urban areas, peripheries, slums, or self-built neighborhoods are suffering from higher COVID-19 infection rates, deaths, and economic recession because they lack sufficient access to adequate infrastructure and facilities, adequate housing, healthcare systems, or livelihoods. These urban areas are mostly inhabited by certain socio-economic communities, the urban poor, informal workers, also by traditionally discriminated against groups, migrants, racialized communities, ethnic groups, and these territories, individuals and groups see how the pandemic is severely worsening their living and health conditions and causing high death rates. And despite disaggregated data by gender, ethnicity, or race is still incomplete or inaccurate, early studies in the United States, for instance, show that Black patients have been dying at a much higher rate than white Americans, more specifically 3.5 times more. And to give a very concrete example related to cities, in April 2020 in the city of Chicago, 70% of COVID-19 deaths had affected Black population, 70%, despite the fact that this population, Black population, only represents 29% of the city's total population. And in the same period, in another US city, Michigan, the Black population accounted for 40% of COVID-19 deaths, although the city's Black population represents only 14% of the total population of Michigan. And a similar pattern is to be found, for instance, in another country, in Brazil, where a Black illiterate person is 3.8 times more likely to die by COVID-19 than a literate white person. And in some Brazilian cities like Sao Paulo, the death rate of Black communities can even rise to 50%, according to some studies. So this data clearly demonstrates to what extent social and health vulnerabilities are exacerbated when entangled with territorial and race inequalities. As far as age is concerned, the UN notes that COVID-19 pandemic is causing untold fear and suffering for all the people across the world. During lockdowns, they suffered greatly by not having access to services, to goods, or to the human touch that they required. And if we look at fatalities, we see that older persons are one of the more visible victims of COVID-19. Together with those people with underlying medical conditions, older persons are at a higher risk of serious illness and death from COVID-19. And to give some data on this issue, death rates for those people over 80 is 5 times the global average. So the difference is quite relevant. And where older persons experience multiple and intersecting forms of discrimination, these have exacerbated during the pandemic and have aggravated the vulnerabilities of this community. Women, for instance, are overrepresented among older persons, and they also represent 46% of persons with disabilities aged 60 and over. So these individuals with intersecting forms of discrimination, age, ability, gender, they generally have more healthcare needs and medical underlying conditions that make them more vulnerable to severe symptoms from COVID-19. In addition to all this, evidence also shows that the pandemic, and this is something that previous panelists have mentioned before, the pandemic has widened the gender gap as a result of the burden of women and girls as caregivers and domestic workers, as a result also of an increased risk of domestic violence during confinement and a poor access to specific healthcare. And the closure of schools during lockdowns has particularly increased the care burden and has also limited the amount of time that women could work. And these problems exacerbate existing socio-economic inequalities, for instance, greater economic insecurity for women, insufficient access to education and to employment opportunities, and all this combined with intersectional discrimination and stigma based on age, race, gender, ability, whatever, shape a harsh scenario of intense multisectorial and gender-based disparities against women. As I said in the beginning, my future paper will basically assess the main challenges posed by COVID-19 in cities of the Atlantic region from the perspective of urban inequalities, with the objective of reflecting on possible recovery paths. It seems clear that urban recovery will have to deal with ensuring material needs, access to healthcare, food security, livelihoods, adequate housing, water and sanitation, urban transport, or even digital connectivity. And beyond these sectorial policies, it remains to be seen what long-term recovery strategies can be envisaged. But since time of today's presentation is scarce, I will leave it here, as I said in the beginning, and looking forward to the discussion, and thank you all for the attention.
Thank you very much, Eva. Thank you for your stimulating intervention. The original way of looking at the pandemic with the urban sociology eyes. Thank you very much. I'm sure it will be a very, very promising work. As you said, it was a work in progress. The progress will be promising. Thank you. So now I give the floor to Elena, and I have to say that the paper that Elena is going to present is in collaboration with Geraldo Maldonado. Elena and Geraldo, the floor is yours.
Can you hear me?
Yes,
yeah?
Yes.
Okay, perfect.
Very good.
Thank you very much. Can you see my screen, my share screen? Yeah, perfect. So thank you very much, Professor Teixeira, for the presentation. And thank you, and many thanks to Leonardo and Jade for this amazing event. I'm very happy to be the last. And it's not normal, because normally I prefer to be the first, because it was great to hear my colleagues. And I think that our presentation it's fit quite a lot with the presentation of my colleagues, because we would like to focus particularly in one group that my colleague has mentioned during their presentation. We are going to focus particularly in the situation of one of the most of the groups which are affecting more the COVID-19, and basically they are migrants. In particular, we are going to focus in the public perception and attitudes on migrants in time of COVID-19. This is the first time that we are going to present something related with this paper. So as you can see, it's the beginning of our research. This is the index of our presentation. And let me start with a sentence from Human Rights Watch that we think that highlight the importance of the topic and the effect of the pandemic on migrants and on society in general. The Human Rights Watch mentioned that several political parties have taken advantage of the COVID-19 crisis to promote conspiracy theories against migrants in favor of white supremacy, ultranationalists, anti-Semitism, and xenophobes that demonize refugees, foreigners, prominent people, and political leaders. So starting with this sentence with Gerardo, our idea was basically, okay, so why don't try to analyze to what extent public opinion is affected by the COVID-19 when we are talking about migrants. What we have found in the literature is not too much, of course, because the phenomenon is very, very recent. But we had the opportunity to analyze or to check, review a few papers. Mostly they are in the context of Europe and United States. And here is very interesting because there are not the literature is not very clear in which is the effect of the COVID-19 in the attitudes or perception about migrants. In fact, we have found two very clear positions. The first one is saying that it is not affecting at all, and the other one, it is affecting quite a lot. So basically, those literature that mention that it is affected, here we have some ideas. On the one hand, it has mentioned that crisis will necessarily lead to increased anti-immigration sentiment. And in the same game, Gamlen, for instance, observed that during times of crisis, immigrants are often used as scapegoats and assert that anti-immigrant sentiment is on the rise. On the other hand, recent literature mentioned that in this case, even normal, we can find that crises are affecting the attitudes and the opinions, the public opinion regarding migrants. In this case, in the COVID-19, is not affecting at all. Why they are mentioning this? Basically because in the case of Europe, for instance, Denison and Geddes mentioned that there is an historical tendency. This is basically that attitude toward migrants have gradually become more positive year on year for the last 20 years or so. So there is a little to suggest that the COVID-19 crisis will dramatically undermine or reserve this long-term trend. On the other hand, in this year, we have seen like a positive discourse related with migrants. For instance, I would like to mention this concept of essential workers. These essential workers are considered central to maintaining basic economic and public health and infrastructure during this crisis period. This means basically that as we are creating this positive discourse, we can see that there are not an effect on public opinion and attitudes on migrants. And finally, we have found that we are not putting much attention in the migration question because we are worried about other issues. No? Many issues that my colleagues has mentioned, like economic situation, healthcare situation, education. So migrants are less exposed to direct public debate. So again, why we are not, what is supposed with this literature, that is COVID-19 is not really affecting perception about migrants. In this context, we would like, of course, to analyze what is going on. Our research question is to what extent COVID-19 affects public attitudes toward migrants. Our idea is to analyze this research question in a comparative manner, the effect of COVID-19 on public opinion before and after. It's to answer the question, we need to see how the public opinion was before the COVID and how it's now, but also we would like to analyze in a comparative manner in the Atlantic region. Our hypotheses are three. The first one is more related with the first position of the literature that mentioned that COVID-19 is affecting in a negative way to the public opinion and perception. The second hypothesis is that nationality explain quite a lot the effects. So we are expecting that, for instance, Chinese nationalities are seen worse than other nationalities. And the hypothesis three, sorry, we would like to analyze and to check to what extent attitudes toward migrants in the economic domain are more affected than, for instance, sociocultural domains. We couldn't find too much data related with that. Just let me show you what is going on in the case of Europe. The only data that we could find, they are public, is the standard Eurobarometer, which was, excuse me, which was carried out in August 2020. The only question that we could find related with the migration is this general question about which are the two most important issues facing the European Union. As you can see, migration, it appears like the third problem for the European Union citizens, but this data is not worse than the last 5-6 years. So migration has maintained this data from the 2015 crisis. It's not worse. But what is very important is when we ask this at the national level, when we do the same question, but do not asking about the European Union, but country by country. And here you can find like the European population is not really mentioning migration as a big problem during the COVID. Actually, these data are the same data that in 2014, even before the 2015 economic crisis. So this is the data that we could find finally to the European Union, but we would like to present you the Mexican case, and I'll give the floor to my colleague, Gerardo.
Hello, thanks a lot for the invitation, especially to Leonardo and Jade, and for the introduction of Professor Teixeira. I would like now to show you some of our results. Just let me remember you that we were expecting at least 3 things. First, that the COVID-19 pandemic would affect generally attitudes or perceptions about immigrants. Second, we also expected that this effect would would apply more to some nationalities or some group of immigrants due to several things that my previous colleagues has stressed. And third, that we expected to have an effect more on economic realm than cultural or political realm. Next, please. We have done this based on two sources of data. First, a survey, a national representative survey done in Mexico since almost the last 2 decades about foreign policy and international politics. But we have the opportunity, thanks to Professor Sanchez Montijano, to collect new data during the pandemic here in Mexico. We were part of a national omnibus survey done by Telephone with the purpose to explore public attitudes about foreigners and also immigration here in Mexico as part of a broader project also coordinated by Elena. And we were able to include these 12 questions in this survey. We wanted to obtain information in 3 different aspects. First, the knowledge and acceptance that we see of immigrant population here in Mexico. Second, the assessment or the evaluation of Mexicans about the contribution of immigrants to the country. And third, the opinion or the support of public policy implementation. And now I will show you some results. Here you have the technical information of this survey done during the first 17 days of July 2020, sorry. And let me show you some of our first results. First, as you can see in this graph, we have collected information in a general opinion about immigrants from at least the last decade. And as you can see here, let me stress one result. There was actually a drop of good opinion about foreigners in Mexico, an important drop of 22 points from 72% of Mexicans having a very good or good opinion, to only 51% of Mexicans having a good opinion. As you can see also, the people who said they have a very bad or bad opinion increased from 12% to 36%. So actually there was a change in opinions about immigrants, perhaps direct or indirect because due to COVID-19. Second, we also asked about different groups of foreigners here in Mexico. And as you can see, there is a difference between these groups. General good opinions, as you can see, are directed to Americans, Spaniards, and Chinese, and there was more negative opinions about Hondurans, Guatemalans, and Venezuelans. But let me stress that in almost all cases, compared to our last survey, the opinion increased in 2 or 3 points, except for 2 groups of foreigners. As you can see here, Americans, actually, there was a decrease of 3 points, and especially Chinese, there was a decrease in 6 points percentage. So as we expected, there was an effect based on nationality. Next, please. We also wanted to collect general positive and negative attitudes toward immigrants. And as you can see here, there are 2 important results. First, there was an increase in all these responses. So people have, in general, a little bit more of positive attitudes concerning bringing innovative ideas and contribute to the Mexican economy, but also there was an increase in the percentage of some negative attitudes like immigrants weaken our customs and tradition and generate insecurity. But let me stress that there actually the greater increase was about the attitude that immigrants take jobs from Mexican. There was an increase on almost 10 points. So it's related more to the economy than other realms. And finally, we also asked some questions about the public preference of granting some rights related to the expectation of integration of these migrants. And as you can see here, there are 2 results. First, there is a great majority of Mexicans granting rights in terms of health services, public education, obtain the job on the similar circumstances or similar conditions. But as you can see here, there was a drop in the support for this of these rights, at least in 2 areas. First, there was a decrease in the agreement to that foreigners can bring their family with them, and especially the support for voting here in Mexico. There was a decrease in 26 points percent. So there was also differentiated in these terms. And now for the last minutes, I come back to Professor Sanchez Montijano.
Thank you, Gerardo. Well, basically, we would like to conclude remembering our hypothesis. Basically, what we have found is that the 3 hypotheses that we thought at the very beginning, we can say that all of them are in the Mexican case, even it's not so clear in the European case. They are really happening in the Mexican one. First one, we can say that COVID-19 is affecting the attitudes toward migrants, as Gerardo has mentioned. If in 2018, 72% of Mexican population has a good opinion about migrants, in 2020 is 51%. Secondly, nationality explained quite well the effect, and this change we saw particularly with Chinese and Americans nationalities. And finally, we like to mention also like there is a change in the perception when we are talking about labor market and job market, particularly related with the economic situation, the economic situation in the COVID context. The future of this paper is continue analyzing the data from Mexico. Actually, in fact, we are thinking if it's possible to carry out another survey in the case of Mexico. And also we are expecting to check or to analyze what is going on in other countries in the Atlantic area in order to compare what is happening. So if someone have data or knows about some data in the region, we will be happy to receive this information. Thank you very much.
Thank you. Thank you, Elena. Thank you, Gerardo, for your presentation. We know that the migrants are one of the most affected social groups by inequality, and pandemic COVID-19 aggravates the situation. So thank you for your interesting work and the empirical data you carry on, because it's very interesting to see it. So now, as the time flies, I give immediately the floor to our discussant, Susanna. Thank you for accepting the invitation and being with us today. The floor is yours, Susanna.
Okay, thanks a lot. So, I mean, I would like, first of all, to thank Nuno Severiano Teixeira and the organizers at Fundação Getulio Vargas for the invitation. It's a pleasure for me to be here discussing all these very interesting insights. I should say that this is not a very easy job because, you know, like I have 10 minutes to go through 4 very nice discussions. So I guess I'll just wrap up a little bit, you know, so instead of going through like the different presentations individually, which I think would maybe not be very interesting also because, you know, we've had presentations already. So I guess that just maybe wrapping up the sort of image that we get from the several contributions here could be more interesting. So, you know, what I think is really important that we as social scientists start reflecting about, and I don't have many clues about how to do that, but there was in the beginning, you know, 1 year ago, everyone was saying that this would be the great equalizer, that this is a virus. Viruses, you know, they infect everyone, they kill everyone, and what we get here is that, you know, what we get from your presentations, and I guess there's by now a reasonably sound body of knowledge that actually would tell us. I mean, I certainly have work that it's really interesting because as you were speaking, you know, many of the things they have mentioned, I actually have my own work about Portugal that completely goes in line with many of your insights. And of course, you know, but there's a lot going on in many countries. So I guess we now have a very clear picture about the fact that the pandemic is, first of all, not, I mean, it's not, even the virus is not an equalizer, because we have data here about how more vulnerable people actually get more, the probability that these people get ill is higher. You had this wonderful presentation about the urban environment and the lack of infrastructure in cities, which of course is more of a problem in lower income and middle income countries, but it's actually a problem also in Portugal. I mean, here, like when we got to the spring or the beginning of the summer, when the pandemic was more or less controlled all over the country in 2020, we still had outbreaks in Lisbon, precisely in the sort of poorest neighborhoods. So you know, that lack of infrastructure is a problem even in, well, you know, in European countries, at least like Portugal, which of course is below the European average in terms of development. Right. So we have this thing that the pandemic is definitely not a great equalizer, from the health perspective, but also from the economic perspective, right? And here we had it went all over the place. So we had gender being mentioned oftentimes. We had, of course, race. We had the migrants. So the situation of the people that are not in their home countries, and I think that's really a big thing, which, by the way, in Portugal we don't really tackle very decently because we don't have a lot of very good data for that. But there are people that have been stranded away in many different parts of the world without being able to go back home. Some of these people were left without income. So there's a lot to do, I think, in terms of what one can have in terms of a multilateral organization, I would say, to deal with migrants, because that's definitely one of the populations that has been left more vulnerable. I mean, in particular, of course, the low-skilled migrants, one of the populations that has been left more vulnerable in face of the pandemic and in face of the sort of general disruption of the travel system. So I've been reading a lot about that, and I think that was actually a very interesting the last presentation. And I should also say that from my work in Portugal, it's been 1 year that I've been working in about all the aspects of this pandemic in Portugal, from the regional aspects to the for instance, the labor market aspects of the pandemic. One of the things that we identify is that the sectors that have the highest share of migrant labor force in Portugal are precisely restaurants and lodging, so hotels, restaurants, and those are the ones, amongst the ones that have been more hit by this pandemic. So, I think it's a challenge everywhere in all, again, in countries at all development levels. So we have this pandemic that is both, very unequal from on the health side and also very unequal on the economic side. And that combines with, I guess, so this bit I'm taking from Salma's and Anna's presentations, combines with a lack of appropriate institutions, I would say. Which of course, that if we had appropriate institutions, probably we wouldn't have this inequality in both, I would say, both risks of this pandemic, which are the health risk and the economic risk. So Anna mentioned a lot about the challenges to democracy, and it's true that we got used to living for now, 1 year without many of our fundamental rights being suspended. And of course, one may wonder, of course, I'm an economist, by the way, so I'm totally not the right person to think about this. But one may wonder, how will our democracies get back to normal? I would suppose that these things leave, there are costs and there are scars. So at least from the economics viewpoint, I know that crises leave scars in firms, they leave scars in people, and I would be very surprised if this suspension of fundamental rights would not leave some sort of scars in our societies. So that would be, I think, one problem. And then, of course, there was the whole discussion about the individualistic behavior of vaccinations, which I think is really, it's one of the most dramatic ways in which one sees how we are very far from building, institutions within country and then across countries that actually allow us to share more or less equally these amazing conquers of the human genius, because the vaccination is amazing. The fact that me as a social scientist, I think it's totally awesome that this natural science scholars were actually the researchers were able to develop this vaccine in less than 1 year. That's amazing. But then we as social scientists, we completely fail on the thing, and certainly we as economists, about creating then the right institutions to share this thing in a more or less decent way. And I was just reading yesterday in the Financial Times that there's tourism to the United Arab Emirates because they have loads of vaccines there. You know, contrary, for instance, to Europe is a disaster in terms of vaccines. Like we're really running behind. But since in the United Arab Emirates, they have loads of vaccines. There's actually tourism of very highly paid people from across Europe that actually are traveling there, sometimes illegally, because sometimes they are traveling, you know, while there are travel bans that are active in their home countries, to actually get there and find a way to get vaccinated through, you know, connections with the powers that be. And I find that really sad, because that's really like, it's like our, you know, it's the institution, I think, even within the countries, even within European countries, where we're supposed to have a social welfare system, which is there to sort of make sure that everyone is, you know, to ensure some sort of equality of opportunity. If very rich people can fly themselves in private jets to get their own vaccination, going against all the rules that the European Union has established, that I find really a disaster. Right. So I guess. So having said that, and I have 1 minute to go, so I'll be very brief. Then
more than 1 minute.
Sorry.
You have more than 1 minute.
Oh, because I thought that since we were running late, I thought that I could do this in 10 minutes. But okay, I'll try to be fast anyway. So, you know, oh, by the way, there's another dimension of inequality that was mentioned here, which is, of course, the age profile. The fact that, I mean, it was very much focused on the elderly, but then there was also the focus on young people. In particular, I know that she mentioned the problem of education, and that's really like a gigantic challenge that we as a humanity are going to face collectively. Because in many parts of, for instance, Latin America is one of the continents where the disruption to the education system is the strongest, and I mean we're most likely going to be facing like a pandemic of school dropouts. So that's really something, again, that, so you know, you have all these dimensions of inequality, of polarization of our society, that this pandemic just made like very clear, despite the fact that in the beginning we thought that we were all together in this ship, and that we're definitely not. We're definitely very, very far from being all together. So I guess that now, you know, I mean, having identified all that, and, you know, it's been now several months when we started noticing that there was no great equalizer. We've all been sitting in different seminars, you know, conferences, whatever, discussions like these, which I think are fantastic, but they're just making it clearer and clearer for all of us that we do have a problem, and that the problem is huge, and that you know, there could be, I think, that potentially the problems that we are facing and the huge gaps that are being created along all these dimensions, they can actually potentially, I guess, even undermine the very foundations of our democracy, because these people that are left behind, you know, they still have the right to vote, and they can do crazy things, basically. That's something that I personally really, I'm very much afraid of that, you know, for the future of my children, and my own as well. So I guess that now, you know, as social scientists, and there's a bunch of us here of different specialities, but we're all social scientists, we really have to start thinking about how can we help, you know, build better institutions, because I think it's really about building better institutions, to be able to share more equally these amazing, you know, these amazing things that we put together in such a short period of time. And of course, I'm mentioning all the health advances, not only the vaccine, because there's obviously, you know, a long way that we've been through in terms of learning how to deal with this disease, and I'm not the right person to discuss that. Yeah, and I guess that now, you know, I think that's like really a general, it's really like it's a general challenge, I guess. And now, if I am allowed to just move a little bit into Europe, Anna was mentioning at the European Union level, the fact that we should be more bolder in terms of looking for common health policies, and you mentioned health intelligence, and I totally agree with that, but I'm very skeptical because, again, when you look at what the European Union has done with the vaccines, and when you compare to Russia, China, the US, Canada, I mean, I just mentioned United Arab Emirates, sorry, Australia, New Zealand, Israel, of course, all these countries are doing so great that I'm very skeptical about. As the European Union is in itself one such institution that could potentially help us being a little bit more decent, I would say, in sharing these gains of the human genius. And I'm very skeptical because I don't see it really doing, not really being up to the expectations in this very difficult year that we've been through. And I'm done. Thanks a lot.
Thank you, Susanna. Thank you very much for your comments. Now we'll have 10, 15 minutes for debate, and I have already some questions. The first one is from Mahaska. What can nations do to ensure that the pandemic doesn't reverse decades of progress of women participation in the labor force, particularly in the Atlantic South? So who wants to begin? About...
Am I allowed, or is it just for the speakers?
Yes, of course. Yes, of course.
I have a very good idea. I have a splendid idea for that. I think the governments have to make all possible efforts to open schools as soon as possible. That's that's a sort of win-win policy, because you are both handling the welfare of the younger generations, not only in terms of their earnings capabilities, but also about lots of things about their future life in terms of like addictive behaviors, and all this has been studied. And moreover, it would be liberating women just a little bit to participate in the labor market. And I think it's probably the very fact that the government, not all but some governments could not do what it takes to leave schools open, because that's it's a political choice at some point, that you don't do what it takes. You have to do what it takes. It's probably in itself a problem of the lack of representation of women in political decision-making fora.
Thank you, Susanna. I have another one. Do you think the pandemic allowed authorities to commit abuse of power in the name of the supposed security? How can international aid or pressure act in that case? Anna, perhaps you have some ideas on that.
Yes, if you allow me to put some insights on this question of security and citizen rights. I think we have two faces of the same coin. The first one, and that is related with the perception of security, is that citizens are vulnerable and more akin to accept that their rights are conditioned, their fundamental rights are conditioned when they perceive that their security is in risk. So in the case of democracies, for example, we are looking to mobility restrictions, to fundamental rights of being provided by some services, etc., to be closed at home. In Portugal, we are in a lockdown, so that is the restriction, a fundamental restriction of our freedom. And but that only happens because the citizens consider that this instrument is used by the state to guarantee their security. So this is one face of the coin. The other face of the coin is exactly the point of exaggerating on the use of security instruments. And that is exactly why I use the example of the apps that take control of some of our mobility, that make the tracking of our contacts and make the tracking of our transmission change, because the question is not using that at the moment to provide security and create an epidemic profile. The question is, who is going to be the property of that data and what is going to be done with that data and what doors it will be open to the biopolitics control. So I don't think that we are talking now, and I don't think we have until now the opinion, the public opinion information that can make us think about the securitization of these procedures. But I think that we should look with that with very acute attention, because this is the basis, this is the fundamental of democracies. This is the guarantees of citizen rights. If authoritarian regimes can do some things without citizens' legitimation and authorization, in the cases of democracies that should not be even think to be done. So my main concern is who is going to guard this data and what doors can be open to use this kind of instruments in different situations.
Thank you, Anna. I have one more question here from Danielle Marcos. To what extent does the question of the access to vaccines put European Union in a position of dependence on powers such as the USA, Russia, or China? Would anyone make some comment on that?
Knowing Susanna, I think that she wants to say something about this, but because we discussed this a lot, I'm going to, if you allow me, to give my interpretation of the international politics. In this case, not such the European Union internal question. In the fact, we discard very, I think something that's very important. The financing of many of this research was made by the European Union. So part of the scientific work that is, as Susanna said, completely amazing, was financed by the European budget. The question here is not, I think, about the creation, the research and the innovation. It's the question of the production and being in the hands of pharmaceuticals and bigger enterprises. And here the European Union failed on the negotiation. The second thing is how this can be seen from Russia and China. And this is why I talked about health diplomacy, because China and Russia are using this instrument to expand the power of influencing and providing needs of other countries. And in the case of the European Union, Russia is trying to divide internally European Union by providing vaccines to some of these member countries. So I think we should look to this pandemic and the vaccine as an instrument of power. And the European Union was very united to get a vaccine on a lower price, but there are some things that European Union is not still an agent. It does not have the same power to transform as the United States, for example. So it loses the access to the vaccine, comparing with other countries that asked for more and have now the access to vaccines to its citizens in different amounts that European Union have.
Well, thank you, Anna, and thank you all. I think we are touching the end of our time. If you allow me just one very, very brief comment to say that in international terms, in international security terms, just I would like to stress the contradiction between the transnational nature of this threat or risk, which is COVID, the pandemics, and the national character, the national nature of the response. So our responses are mostly national. At the in the health system, in the economic recovery, and even at the political level, because there were different ways, according with the different political systems, to respond. And the impression that I got is that to some extent, the only way to face a transnational threat as a pandemic is international cooperation, is to increase, is to work on the future of a global governance system. It's the only way. I think it's the great challenge that we have. But anyway, I would like just to thank you very, very, very much to you all for your presentations. Also to Susanna for the comments and the very, very rich debate that we have today. And I think it's a very good contribution for our project and for our network, Jean Monnet Network. So thank you very much. And I now give the floor to Leonardo. I think we have to close our cameras and then return for the last session. But anyway, I give the word to Leonardo.
Thank you very much, Professor Nuno. Yes, I think we reached the final points of our conference. Well, it's a conference. We had yesterday 2 panels, one introduction, 2 panels, and now we have the last panel and the wrap-up session. So where I myself representing the Getulio Vargas Foundation and the International Intelligence Units, and Professor Nuno Ipri and Professor Ana Sidob are representing the panels, because each of us was led the panels to this moment. So I would like to start as Professor Nuno ended. Thank you, everybody. I would like to thank you, all my colleagues in the network. You were instrumental to make everything happen. I would like to thank you, my team at the IIU here at FGV, especially Jade, that has been leading the charge in all this organization, the technical team from Getulio Vargas Foundation, and also, of course, the audience. Thank you, because we are doing that for you. Before going to the wrap-up session per se, I'd like to, again, present to you guys that's the Jean Monnet Atlantic Network 2.0. The idea is to discuss mainly energy sustainability, trade and economics, and security and inequality. This network has been going for quite some time. This is the 3rd cycle of the network, so we've been starting again all these discussions. Please go to our website. If you take a look in the description of the video in the YouTube from each of the panels, you can see the link of the websites. Everything that we are doing here is going to the websites. Everything that we presented here is going to the websites. And we will be going to be organizing more events, more webinars, presenting more papers. Everything is going to the website. So please go there, because it's going to be a very rich pool of information within these things. I myself have to present a little bit, wrap up a little bit about the first panel. The panel of transborder economic flows from the Atlantic perspective. Rethinking trade and economic cooperation in times of US-China tech war, COVID-19, and other themes. This panel was presented by Professor Renato Flores, that moderated and also spoke a little bit about themes about WTO, Professor Mário Teló, Professor Eduardo Soler, Professor Mário Teló from Université Libre de Bruxelles, Professor Eduardo Soler from CDOB, Professor Abdelaziz Abdi Ali from the New South West Center, and Mark Aspinall from CID, from Mexico. Well, Professor Teló more or less tried to discuss a little bit about this new event of the signature of the comprehensive agreements on investments between EU and China, the CIA. This is a very interesting new instrument, because somehow, according to Professor Teló, there is a power shift, our economic shift to the Pacific. I mean, we have been reading that for almost 10 years now, but up to now, somehow, EU has been focusing a lot on the Atlantic, and for proving his points, he presented the EU-Canada agreements in 2016. He mentioned the attempts of agreements between EU and USA, but frozen by the former President Trump, the Mexico agreements with EU in 2018, and now the EU-Mercosur agreement in 2019. So that is to say that somehow you're still focusing on the Atlantic, but now they're trying to balance a little bit more with new agreements, and this is the first new agreements with large agreements with China. To discuss all these issues about this agreement with China, he used a theoretical framework of discussing multilateralism. I mean, what is this agreement? Is it a bilateral agreement because it's between two players, or is it a multilateral agreement because there are more players within the EU and China? So I'm not going to dive on theoretical issues here, but the thing is, his argument per se is saying that it is a hybrid bilateral agreement. It is a necessary agreement because there is a context right now that offers the possibility to EU to move towards Asia faster. I mean, we have the vacuum created by President Trump. We have the Chinese attempt to revamp RCEP. So there is a momentum that EU, according to Professor Tello, has to take advantage of that, even because China is unavoidable. I mean, his exact words were, containing China is not feasible. I mean, China is one of the largest economies in the world. It's incredible, the interdependence and the role of Chinese role in supply chains nowadays. China is pivotal to any kind of modification and kind of reform of all the major international organizations. So it's more or less impossible to avoid China. It's more or less impossible to corner China in a given corner and make our business elsewhere. So to do that, it's very important that the EU has to, by pivoting to the Pacific, or perhaps balancing its priorities in that landscape with the Pacific, focusing a lot on China. Although he mentioned China is not the only targets of initiatives. I mean, there are other initiatives that he mentioned, for instance, agreements with Asia and other group organizations or countries. Well, to sum up his presentation, he made three conclusions, very brief conclusions, responding to questions that he posed. The first conclusion is yes, bilateralism initiatives, yes, could leverage multilateralism, especially in hybrid agreements like such this one between China and EU. The second conclusion is that to avoid negative consequences to an economic power shift to the Pacific, there are three comprehensive ways to try to avoid these negative consequences. The first one, we have to organize a broader coalition for UN and WTO reform. It's important to do that. I mean, it's cover all the globe, but it's important to making more losers in this shift. The second complementary way is try to reform and deepening any trade and investment transatlantic treaties. I mean, you have to, and not necessarily empower, but give more attention and try to make them more stronger. Let's say stronger. I'm losing the word here. And the third complementary way is deepening regional agreements between EU and South America. I mean, it's important in Professor Tello's opinion that the Mercosur-EU agreement is very important, it's pivotal. It's the first of a kind between two ecosystem unions. It's a very broad, it's a broader agreement because it's not only covering trade issues, but also regulatory issues. So I think that it's a very important agreement that can extrapolate to other places. I mean, it can create waves that can help other initiatives in the future. So it's very important. And the third conclusion, to close Professor Tello's arguments, is that there is a need to go for an open strategy of autonomy within the EU. Let me rephrase that. There is a discussion nowadays in the EU about an open strategic autonomy led by the European Union in the international society. And it's important to say that autonomy does not mean protectionism. It's different. I mean, he's stressed that a lot. I mean, the idea is that the idea of autonomy is that EU should have the ability to use its own capability in the way it chooses to. I mean, it's not vulnerable to other situations that oblige, that require that EU has to function, to behave in a way that it not would like to do in the first place. So that's one thing that he think that's nowadays is within the EU, and he's supported. Following Professor Tello, we go to Professor Flores. he basically discussed very briefly on the future of WTO. For that, he laid out a groundwork assumption that the general agreements for almost everybody is that WTO is for free trade. I mean, the idea is that the general agreement is that all of us agree that we need WTO, and WTO is perhaps the paladin, the current paladin of the free trade. So, going with this groundwork assumption, he highlighted between many different critics that people might have about WTO, he highlighted 3 critics about the WTO right now. The first one is that WTO became old. That means that somehow WTO still only focusing like GATT in the past, right now, still focusing only in free trades. But somehow free trades, he said that free trade right now is not an absolute truth. That's his exactly words. I mean, that's very interesting because right now he's trying to make us understand that there is an urgent needs of jobs. I mean, jobs are the major thing right now. So, you know, his opinion, many different countries right now are organizing policies. They are laying out policies that are protectionist, but they are protectionist because they need to revamp their labor markets in their own country. So jobs right now are something that we cannot escape. We cannot assume that whenever we sign a given trade deal with any other country, some sectors will be losers, of course. But that's problem will be overcome by the general benefits that a given trade deal would offer us. That's not more feasible right now. I mean, this narrative cannot play well, especially in democratic countries right now. So somehow, in his opinion, right now, the free trade principles have to reconcile with the jobs. I mean, the job creation. The second one is the appeal body. In his opinion, the appeal body right now is all the decisions of the appeal body are being reorganized in a way. I mean, that some decisions of the WTO are using those later decisions from the appeal body, and now they are creating new understandings that are not necessarily reflecting the new deals that are coming. So the rulings of the WTO are not reflecting the spirits of the agreements sometimes. And the last and third biggest problem, in his opinion, is the big transnational companies. Those companies that are too big to regulate, they are basically running amok right now and they're not being regulated. So in his opinion, it's necessary to regulate big companies. Better yet, WTO has to conceive a better understanding, definition, and rules concerning those big enterprises. And he closes in a way that's kind of not very in a positive way, that he posed a question: how can we do the necessary changes to deal with those problems? And in his opinion, unfortunately, right now, he believes it's mission impossible. There's a lot of problems right now that we're dealing, especially within the WTO that backs to 2008 crisis, and we're not being able to move faster in the necessary reform that WTO requires. I'm almost over my time, so I'll pick up faster. Dr. Soller presents a very interesting idea about geopolitics of vaccine. He tried to, again, within a framework, a theoretical framework of cooperation and competition, he tried to show us that there is right now geopolitics of the vaccines. There is right now vaccine diplomacy model that's very interesting to take a look right now. He made it clear that he's doing this research right now. I mean, so that's impossible to have all the data at that very moment to make any kind of conclusion. But I think that's what caught my attention right now is that right now we have a very interesting laboratory that's trying to understand how Global South can be organizing its cooperation, and how the next summits between CELAC and US summits, for instance, they are a laboratory of how South and North are organizing, are conceiving ideas about how to deal with this vaccination. The other participants were commenters, but I get discussed a little bit about free trades, but I had already passed a lot of my time, and I have to pass the word to Professor Nuno that has to say something and then perhaps leave. Professor Nuno, the floor is yours. It's muted.
It's okay now. It's okay. Okay, thank you so much. I don't know. Would you like to? That I would like to say just thanks very much, and or I am supposed to make some speech, or I didn't understand.
Highlight the 2-3 top things that you took out of your panel.
Okay, thank you. So in this panel, 2 or 3 topics that I think are the most important. The first one about security. When we talk about security, we are not talking about the state. We are not talking about the use of force. We are speaking about security in a broad sense, in a large and deep concept, including more than the state, the people. The security of people, the human security in this large sense. Second, in this way, more than the use of force, we have to use the use of knowledge. I mean, the knowledge for climate change, the knowledge for food security, the knowledge for biological security. In this case, the problem of the pandemic. So this is the framework where we are thinking about. In the panel, there are 2 things that I think are the most important. We had different perspectives from different points of view. I mean, from political science, from international relations, from economy, from urban sociology. But in these very, very different perspectives, we have 2 things in common. The first one is that inequality, the COVID aggravates inequality. COVID aggravates the inequality in different layers of the people's life: gender, migrants, aging people. So different areas where inequality increased during the pandemic. The second idea that I would like to stress is about the response to this kind of risks and threats. We respond to this crisis, to this pandemic crisis, which is a transnational crisis, in a way, in a national base, we can say. So not only at the level of the health systems, vaccination, but also in terms of economic recovery. Well, European Union is a little different, but in general is a national response to a transnational threat. So the challenge that we have ahead is the challenge of trying to increase international cooperation in order to have a more coordinated response. That means to develop, to work in terms of global governance. So this is the most important or the most common ideas that I think that we can share.
Excellent. Thank you very much, Professor Nuno. Professor Hanna, would you like to share some ideas of your panel with the audience?
Thank you. Congratulations all the team of the organization of this successful webinar. Yes, I will try to summarize a little bit what we discussed in the second panel about energy and sustainability yesterday. We discussed about a transatlantic vision of the green agenda for a post-pandemic recovery. So also we're concentrated in the post-COVID times. We had only 2 presentations, but very complete. The one
The first one was for Daniela Stevens, that presented a paper about Joe Biden's initiatives to reconstruct the international climate change agenda and the implications for the transatlantic cooperation. And the second one was the presentation of Rim Berahap, that presented a paper about the green recovery in Africa, focus in the Nigeria case. And we had the comments that complete these presentations from Rodrigo Pimentel, Frank Mateis, and Carmen Fonseca. Although these two presentations were focused in the policies of two specific countries, the reflections of the group help us to analyze some of the great challenges of the green transition in the Atlantic, and not only the Atlantic, but the worldwide. The arrival of Joe Biden at the White House and its commitment to the international agenda against climate change created great expectations of a strong impulse of the energy transition policies that could help to lead us to a post-carbon goal. But in the session, we distilled a lot of obstacles to arrive to this objective, and we also discuss about which are the resources that we will need, the cost to achieve these goals, and the resources are not available for all the countries. No? Well, Daniela analyzed the first measures taken by Biden, both internally and externally. At the internal level, she highlighted the regulatory measures that aim to provide supply efficiency in the country and to reduce the emissions, the carbon emissions, and include credit aid for investments and requirements for greater transparency for the companies. These are the first measures inside the country. But regarding external actions, she also stressed the return of the United States to the Paris Agreement and the expectation generated by the establishment of new long-term goals that will be taken to the next climate change summit, that the COP26 that will be in Glasgow in November, next November 2021. And this creates new opportunities for multilateral collaboration and within the United States, the European Union, but also with all the countries of the Atlantic, and especially with the multilateral initiatives like the Green Climate Fund or the Adaptation Action Area, that so we can expect more impulse to these initiatives. And going to the other paper, on the other side, Grim highlighted that the issue of green recovery in Africa, given the current situation, is very challenging because the continent must simultaneously meet a triple challenge. First, fighting the pandemic with scarce resources. Second, to boost the economy. And third, ensuring the sustainability of this development initiatives. So in the case of Nigeria, these challenges that are common of all the countries of Africa are added with a persistent energy crisis due to the different factors like the volatility of oil prices, security threats, lack of infrastructures, and disruptions in supply of energy. So she said that as other countries in the continent, it is very unlikely that Nigeria could abandon oil in the short term. So we will think in the medium term the expectation is that Nigeria tried to transform the energy system in the direction to a more diversified energy mix, a stronger regulatory and a policy framework, and the support to the development of new energy technologies. But all this will require significant investment and financing, so strengthening transatlantic cooperation will be necessary. In this direction, Nigeria and the European Union have already concluded many partnerships, including energy issues. And now one question that arises, and that's pointed out by Rim, is the question of the implications of the European Green Deal on oil exporting countries like Nigeria. And she said that this point deserves further research from our part. Well, through the session, the issue of China's influence in the Atlantic South, both in Africa and Latin America, was largely discussed. And although it was recognized that there is a competition and some concerns about the lack of transparency in investments from China in Africa and Latin America, and also concerns about the corruption, even though it was also pointed out that there are windows of opportunity for greater collaboration in the establishment of international goals and regulations, and that an alliance between the Atlantic countries and the South-South cooperation will be very convenient to coordinate positions in multilateral forums. To finish, in general terms, I think we can identify 4 kinds of great challenges. First is the challenge related to guarantee access to the technology necessary to make the energy transition. The second is the need to the resources needed to invest in infrastructures necessary to ensure energy security access for all the population. Third, to improve regulatory measures, both internally in the countries and internationally, for greater transparency and ensure the compliance with the established goals. And the last one, not less important, I think, is changes needed in the citizens' culture on sustainable use in the production and consumption of energy. For all these big challenges, of course, we need stronger and better international cooperation, and the Atlantic space is one opportunity to do that and beyond in the international community together. That's all.
Thank you very much, Anna. It was a great panel indeed. I mean, energy, in fact, and sustainability, of course, is one of the major themes, not only of our dialogues, but internationally nowadays. I mean, it's one of the top themes. Well, I will end this session in the same way that I started. Thank you, everybody. I mean, thank you again, our network members, especially IPRI and CDOB that help us organize as theme coordinators. Thank you again, our team in WIU and the technical team of FGV and all the audience. Thank you very much. Again, please do take a look at our sites, websites. Watch the presentations that we will post, the papers that we will post from this seminar and from the upcoming webinars that we will be organizing in the next 2 years. So there's going to be a lot of material going on almost every semester in the website. So please be there, because I think it will be, again, a pool of information very interesting about Atlantic dialogues. So thank you very much.